Hello viewers, in this video we will be discussing about the role of sperm in miscarriages. Suppose your partner or female, your wife or female partner is having frequent miscarriages, then where to start evaluation? So many people ask me, doctor, is it sperm related or my wife related? Many people say, doctor, my wife did not take rest, she traveled in auto, she did regular household work, so that is the reason for miscarriage. And some say, doctor, she had fever, so she had miscarriage. Basically, we divide these miscarriages into two types. One is early pregnancy loss and late pregnancy loss. So if it happens in first 12 weeks of pregnancy, then it is called early pregnancy loss. So in 70 to 80% of couples with early pregnancy loss, the main problem or main issue is the sperm. But in late pregnancy loss, that means if miscarriage occurs after 12th to 14th week of pregnancy, then the role of sperm is only 10%. So now, what you have to understand is, if their miscarriages are happening in first 12 weeks of pregnancy, then first thing what you have to do is you have to check for the sperm. Why sperm is important is, see, sperm is nothing but a vehicle. Now this sperm has to carry your DNA to the oocyte. That is the role of the sperm. Then normally in semen analysis, what we see, how many sperms are there, how many of them are moving, how many of the sperms are looking normal, that is what we look in semen analysis test. But what if the DNA of the sperm itself is abnormal? Then this can lead to miscarriage. That affects the growth of the baby. So now in basically in DNA, there are so many segments in the DNA. Each segment represents growth of certain organ in the baby. Now if there is problem at one level, DNA damage at one level, then the growth of the baby will stop at that particular level. So now why this is important is, there are so many couples who are having early pregnancy loss, and most of them are being evaluated for female partner issues. They do genetic tests, they do all kinds of hormones, and they prepare them for second pregnancy, but what they miss is male factor. So recurrent pregnancy loss, early pregnancy loss, that is in less than 12 weeks, first sperm factor has to be evaluated. So abnormal sperms, more number of abnormal sperms, that is called teratospermia, or infections in the semen, positive semen cultures, or third one is high DNA fragmentation or high DNA damage in the sperm. We call it as abnormal DFI or sperm DNA fragmentation index. All these things can cause early pregnancy loss. So in case of early pregnancy loss, these are the tests we have to do: semen culture, DFI sperm DNA fragmentation index test, and regular semen analysis. Doing only regular basic semen analysis may not help. So in case any of your friends, family members, or known people, if they are having recurrent pregnancy loss, then tell them to rule out male factor.